I'm glad you've been enjoying our tour of beta-lactam antibiotics, and I can tell you just can't wait to get to our next destination. But let's take a little detour. We've been at this place for, 20 minutes now? Does anyone else need a beverage? I know a place, and hear me out, it's a little rough around the edges. I mean, don't get me wrong, it's a great establishment. This plant has got a great night scene. It's just a little murdery on occasion. But when you signed up for this tour, I promised to show you the real beta-lactam antibiotics, not some phony touristy version. So just remember to stay right behind me, never look a bounty hunter in the eye, and never wait for him to shoot first. Anyway, I know a guy who can get us in. Welcome to Amino's Space Cantina. In this sketch, we're going to be covering the aminopenicillins Amoxicillin and Ampicillin, as well as two other broad-spectrum penicillins, Piperacillin and Ticarcillin. Take a look in the sky window, and we can see the same beta-lactam ringed planet to remind us that we're still dealing with beta-lactam antibiotics. Also, looming in the distance is the death caucus, under construction with its cell wall structure exposed, to remind us again that the mechanism of action of all penicillins is to halt peptidoglycan synthesis at the bacterial cell wall by binding PBPs and killing the cell. It's bactericidal. In our tour so far, we've covered penicillin and anti-staphylococcal penicillins, antibiotics used primarily for gram-positive infections like staph and strep. And notice around the death caucus, we see clusters and chains of purple space stations. But take a look inside, a kind of gaudy yet tasteful red theme. That's because aminopenicillins retain the antibacterial spectrum of penicillins, but also have improved activity against gram-negative bacteria because of their enhanced ability to penetrate the gram-negative outer membrane. Because of this, they are considered broad-spectrum, and we'll represent this with a prism hanging from the ceiling and causing a cool rainbow effect. Yeah, aminopenicillins are amped-up penicillins ready to party. The aminopenicillins, Amoxicillin and Ampicillin, have similar spectrums of activity, but amoxicillin is better absorbed orally. Amoxicillin will be represented by an ammo box, a recurring theme from Sketchy Micro. And we'll emphasize oral bioavailability here with the open mouth of our rebel pilot, or smuggler, or mercenary. Look, all I know about him is that his name is Ampicillin, and it's probably best not to antagonize him while he's bored. He looks like the kind of guy that shoots first and asks questions later. Ampicillin is wearing a red bandana, the symbol of the resistance, around his neck, to remind us that oral amoxicillin is often used in children to treat strep throat caused by strep pyogenes. Amoxicillin is also given orally to treat sinusitis, otitis, and respiratory tract infections, often caused by strep species. All these are represented here on this shady character in the middle of some secret, probably perfectly legitimate, deal with Ampicillin. Also notice that he's plugging his ears, and he's got some gross and socially awkward, goopy stuff dripping from. Are those head tubes? Well, whatever they are, amoxicillin is effective in treating otitis media and sinusitis, often caused by strep pneumo, H. flu, and moraxella. Take a look at his armor, too, and notice the dented, rusty lung spots, worn from quite a few altercations with smugglers trying to reclaim his boss's debts. Amoxicillin is also an option when treating pneumonia because of its activity against strep pneumo and H. flu. To highlight aminopenicillin's effectiveness against H. flu, in the sky window above, we can see the H. flu plane from Sketchy Micro. Now it's an H. flu spaceship. Do you see the H structure in its wings? Also important to remember is that amoxicillin is part of the triple therapy for H. pylori. Now, Ampicillin is a pilot, of course, a helicopter pilot, and his Helicobacter helicopter is in the hangar behind him. All alliterations aside, amoxicillin is also an option for treating Lyme disease, if it's early stage or in young children. And Ampicillin is more than just a smuggler. He's also a mercenary. And his next target, pun intended, is Robin of Ixodes, a recurring symbol for Lyme disease caused by Borrelia burgdorferi transmitted by the Ixodes tick. He's a wanted space outlaw, of course, and be sure to watch the Sketchy Micro video that includes a northeastern Borrelia bow and arrow tournament. Now, why is that alien rife with streptococcal infections plugging his ears? Well, this is a cantina after all, and no cantina is complete without a band. We've got a guitarist here hooked up to an amp to remind us of Ampicillin, and his guitar cord looks like IV to represent IV administration. Because when ampicillin is given IV, it's useful for treating serious infections caused by anaerobes, such as aspiration pneumonia. Hence the red gas mask, our recurring sketchy symbol for anaerobic coverage. Also, ampicillin treats Enterococcus, a resistant bug that causes UTIs and endocarditis. And next to our guitarist, we've got a drummer ready to rock with a purple double bass drum highlighting the gram-positive Diplococcus shape of Enterococcus. Because resistant strains are important, we've made him a little too heavy metal, and he's kicking over one of the amps as he rocks out because beta-lactamases confer resistance to ampicillin. Listeria, an important cause of meningitis in infants and the elderly, is also treated with ampicillin. And notice that our star shredder is wearing our recurring meningitis space helmet with the red meningitis mohawk to symbolize meningitis in young patients. And right behind him is tonight's set listeria. Get it? When a question that points to meningitis comes up on an exam, always think of very young and very old patients who might require the addition of ampicillin to their regimen in order to cover this bug. If we take a look at the bar, we can see the red gram-negative theme, of course, but take a look at these taps for fermented galactic libations. Looks kind of like intestine. Tasty. I just wanted to remind you that aminopenicillins are effective against gastrointestinal and urinary tract gram-negative rods like E. coli, though they are not likely first-line drugs, and this is low yield for an exam. I just wanted to emphasize the extended spectrum of activity of aminopenicillins. Ampicillin and amoxicillin are beta-lactamase sensitive, just like penicillin. Remember those beta-lactamase troopers with those plasmid ring guns from the penicillin sketch? Well, here's one now, a beta-lactamase bouncer on the lookout for suspicious characters. He looks intimidating, I know, but we're on the list, don't worry. To combat beta-lactamases, aminopenicillins are often paired with a beta-lactamase inhibitor, for example, amoxicillin with clavulanate. If we take a look at the sign out front, looks like the beta-lactamase bouncer is making sure that no smuggled ammo is allowed inside. But clavulanate is inhibiting the beta-lactamase, represented by this clavulanate clarinet player creating a distraction so that ammo boxes can be smuggled inside. So as you can see, amoxicillin is paired with clavulanate, and that's also called augmentin. Ticarcillin, another extended spectrum beta-lactam we'll meet in a little bit, is also often paired with clavulanate. There are also a few other beta-lactamase inhibitors, including sulbactam and tazobactam. Next to our distracting clarinet player, we'll add in some tambourine players, standing back to back. Ampicillin is often paired with sulbactam, and that's called unison. Piperacillin, another extended spectrum beta-lactam that I'm sure we'll run into somewhere in here, is often paired with tazobactam. The addition of beta-lactamase inhibitors extends the activity of these penicillins to include beta-lactamase-producing strains of Staph aureus. Now they're really amped up. In fact, they're so amped up that one of our rebel fighters over here is using some force on this guy's face, if you know what I mean. He has a hole torn over his upper left abdominal quadrant to represent asplenia. Asplenic patients are at higher risk for infection from encapsulated bacteria such as strep pneumo and H. flu, two bugs highlighted in this sketch. Amoxicillin specifically provides good coverage, and it's used as antimicrobial prophylaxis in very young patients, post-splenectomy, and in asplenic patients with fever. Now, notice that the other guy's tooth is flying out. That's to remind you that amoxicillin is also used as antimicrobial prophylaxis before dental procedures in patients at high risk for endocarditis. And check out this character here with his red mask falling, or sloughing, off his face to help you remember that aminopenicillins can be associated with Stevens-Johnson syndrome and toxic epidermal necrolysis. And another rash-related fact to remember, ampicillin and amoxicillin can be associated with skin rash when prescribed in the setting of viral illnesses, such as an acute Epstein-Barr virus infection. But unlike SJS or TENS, the rash isn't serious and resolves on its own. As you can see, things can get pretty out of hand at Amino's Cantina, and we're likely to experience a few adverse effects. Worldwide, amoxicillin clavulanate is one of the most commonly reported causes of drug-induced liver injury. Let this little guy with the big liver spot getting trampled by the cantina patrons remind you of this liver injury. Another thing to remember: ampicillin and amoxicillin can be associated with skin rashes when prescribed in the setting of viral illnesses, such as an acute Epstein-Barr virus infection. Take a look at the red flashy lights on Epstein's bar on the far side of the room. Classy place, I bet. We're going to run into two more extended spectrum penicillins in this sketch, not aminopenicillins. These are the big guns, piperacillin and ticarcillin. Piperacillin, a ureteropenicillin, will be represented by this guy on the pipes, and ticarcillin, a carboxypenicillin, will be represented by the hip tiger stripes on his jumpsuit. As I mentioned before, just like ampicillin and amoxicillin, these guys are also often paired with beta-lactamase inhibitors. Piperacillin with tazobactam, one of our tambourine players, and ticarcillin with clavulanate, the clarinet virtuoso. Also remember that their broad spectrum of coverage includes anaerobes, like those that cause aspiration pneumonia. Anaerobic coverage will again be represented by this gas mask on the tiger-striped pipers. The most important thing you can remember, though, is that they're active against Pseudomonas. And here, piperacillin and ticarcillin are wooing a space lady with the most enigmatic smile in the entire galaxy. Resembling Mona Lisa, of course, our recurring symbol for Pseudomonas. Pseudomonas coverage is often important to consider in hospital-acquired infections and patients at risk for multi-drug resistant bacterial infections. And you know what? In future sketches, whenever you see our broad-spectrum prism, along with our Pseudomonas Mona Lisa, rest assured that this is one of your big gun antibiotics used for empiric treatment of serious infections. So, because of their broad spectrum of action, including activity against Pseudomonas and anaerobes, pip, tazo, and co-ticarclav are used for serious infections such as hospital-acquired pneumonia and the empiric treatment of sepsis. Well, that's it. Let's sum up this sketch. Aminopenicillins have extended gram-negative coverage compared to penicillin. Remember that amoxicillin is good for sinus infections, respiratory tract infections, and acute otitis media, and that it has coverage for H. pylori and Lyme disease. For ampicillin, remember that it's good for that listeria meningitis in young patients. For ticarcillin and piperacillin, these are your big guns that have anaerobic coverage and can also cover Pseudomonas. And all these guys are paired with beta-lactamase inhibitors so that they aren't cleaved by beta-lactamases. And don't forget the side effects of penicillins and other beta-lactams that we talked about in the penicillin sketch. Alright, in our next scene, we recruit the help of some charming, yet ruthless, cephalopods.